Determination of the rate of blood clotting and the duration of bleeding. Blood coagulation is an important process for the human body, since, if it is violated, a person is at risk of bleeding in case of serious deviation from the norm. A person risks to face thrombosis of large vessels. The blood clotting process is achieved thanks to the content of a special protein called fibrinogen. Then blood clotting fibrinogen turns into a kind of fibrin that tightly clogs the damaged vessel. The function of this protein is to form blood clots and increase blood viscosity. We will determine the rate of blood coagulation. For this we need a stopwatch, alcohol, cotton wool, scarifier and glass. First, you need to treat the index finger with alcohol and make a puncture with a scarifier. A drop of blood from a finger is applied to the slide and the stopwatch is started. After 2 minutes, every 20 to 30 seconds, it's necessary to pull up the drop, tracing the time of the appearance of fibrin out of some people reaching for the needle. After the detection of fibrin filaments, they fix the time of the end of blood coagulation. We will enter the received date into the protocol. To do this, you must indicate the date of the study, information about the patient, name, age, gender. Sketch and write down the results, make a conclusion. The blood clotting rate was 3 minutes, which is normal, as well as an increase in blood clotting time, hypercoagulation. An increased clotting time is accompanied by a prolonged formation of a blood clot and an increase in the duration of bleeding. We will determine the bleeding time according to Duke. First, you need to treat the index finger with alcohol and make a puncture with a scarifier. We get the first drop of promotive blood with its filter paper. They mark it with a stopwatch. Protruding drops of blood every 30 seconds, promotive with filter paper without touching the cranky. Each time a drop of blood becomes smaller on filter paper, this means the bleeding gradually stops. As soon as the moment comes, the new drops of blood do not form a tone. That is, there is no trace of blood left on the filter paper. Turn off the stopwatch and record the total duration of bleeding. Normally the bleeding time, according to Duke, does not exceed 3 to 5 minutes. Its increase is observed with severe thrombocytopenia or severe forms of some thrombocytopathy. We will enter the received date into the protocol. To do this, you need to sketch and write down the results obtained. Draw a conclusion. The bleeding time was 3.5 minutes, which is normal.